Did it work? Okay, perfect. We've been trying to go live for about 10 minutes now. All right, so I got Kim here, Dr. Evan Chait here from Kinetic Rehab and Spine. Please do us a favor, go to our YouTube channel. If you like us, subscribe, share the love, share the video. So Kim here has some low back pain.
Yes.
Right? Can you turn around to the camera where your pain is?
It's right here.
So it's hips, low back. What motions bother you?
Sitting.
Sitting. And you said bending backwards hurts too, right?
Yes.
So if you bend backwards, does that bother you at all? If you, let's face the camera. If you bend backwards to one side and compare it, left to right side, compare that and do the other side for me. How does that feel differently?
This side hurts a little bit more.
Go into left side. And do you typically get back pain on the left side?
Yes.
Yes. On the lower left side. Is it more so on the left side than right side, or are they symmetrical?
They're kind of symmetrical.
They're kind of symmetrical. All right. So now when you bend forward and try to touch your toes,
That doesn't hurt.
that does that actually make you feel a little bit better?
A little bit.
Okay. And then come back up. Now do that again, but come around this side. I want you guys to may I lift your shirt off. Would that be okay? I want you to see what happens, and automatically I have an idea what's going on with her just through palpation. All right. Now bend forward again and touch your toes. Now I just want you to zoom here. This part of the spine is not. She's not inverting that position, so it's flat. You see how flat it is right there? Now watch, back up now a little bit. Now watch when she comes back up, and it gets a little glitchy. It's not really a smooth transition. So what's happening is the erector spinae are so tight, so the muscles in through here are so tight, that's not allowing her to have a smooth transition from forward bending and coming back up. Now more importantly, when I come through here, come close, and I run my fingers up and down, you'll see, or you could actually feel, I don't know if you could see it, but the spine is actually stacking forward. It's migrating forward or anteriorly. So a really cool technique we're gonna do is cupping. Can you grab me a cupping set? It's behind you. And so we have a motion that we know that bothers her. It's bending backwards that typically bothers you, right? Yeah. There's also sitting. Can you sit down and see how it feels in sitting?
When I go like this, that hurts.
That hurts?
When I go back.
You go back like that. All right, perfect. All right, do it again for me. So the camera can see and I can see. All right, so that's bothering. So the moment she tries rolling her pelvis underneath her, she gets back pain. So I have a sinking suspicion, if you stand up, that it is the muscles that actually attach along the spinous processes and through here. And so I'm just gonna do some cupping. Now the cupping, what that does, it lifts the skin up and it relaxes the muscles underneath it. Now, I'm a big fan of cupping with movement. So it's not mobilizations with movement, but cupping with movement. And we will see how she feels differently after. This is gonna suck a little bit. No pun, because I'm doing cups. Do me a favor, I just want you to bend forward and touch your toes again. And it's tough initially, right? So as she's bending forward, I'm stretching those muscles, that fascia that was there, that wasn't allowing the spine to flatten out. And she's gonna slowly bend forward as far as she can. And she's gonna do this just a few times. And then come back up. Just let me know if we're still live. And if you're live, give me hearts, give me thumbs up, and then do it again. Do it 3 to 5 more times. Now, if this helps, and I'm pretty sure it will. It'll probably reduce the pain by 50 to 80%. Now, it's just like showering on a Monday and expect to be clean on a Friday. This type of exercise needs to be done repetitiously. That's why when you look at all PT research or even acupuncture research or whatever the research is on frequency, all the research always points to 3 times a week initially because we need to reprogram the brain and nervous system. Just like going to the gym for the first time, if you want to lose weight or put muscle mass on, keep on going to the gym 1 day a week, you're not going to get the same results as going 3 times a week. But if you go 10 times a week to the gym, it's going to affect you as well because you need to have that balance. But most of the research is 3 times a week initially until you feel consistently about 80% better. It's getting a little bit easier, right? So now I'm going to take these off. And now do me a favor. You're going to put your hands on your hips and you're going to bend backwards and let us know how you feel differently. Yeah. Do you notice a difference in range of motion as well?
Yeah, I feel looser.
You feel looser? I don't know if you see that in the camera. Are you lying because you're on camera?
No.
Okay, all right. All right, you sure?
I'm sure.
Okay.
Yeah.
Okay, now do the sitting test for me. Dave, would you be able to cut a piece of kinesio tape about 4 or 5 inches for me? And I'll do the sit test.
It's on the bottom shelf of the card there. Yeah.
How much better is that now?
A lot better.
A lot. Give me a percentage.
It's almost gone.
It's almost gone. All right, so the treatment, that was, how long did that take?
Less, like a minute?
A minute, right? The treatment doesn't take long, but what we need to do is identify the asymmetries that's causing your pain. Pain is all about asymmetries. 80% of us are fast responders. So no matter what you do, put duct tape on somebody, bubble gum, super glue, it doesn't matter what it is, right? Everybody's a fast responder most of the time, 80% of everybody. But there's faster techniques to work on fast responders, like this. So we need to assess your asymmetry, see what the problem is. Because if I just looked at whether the spine was closing or not closing, and I didn't palpate the spine that was moving forward, I would have chose the wrong treatment. Okay, so now what I want to do is tape. Thank you, sir. And let's have you stand up. And bend forward and touch your toes again. And so this bruising is normal. It's going to last a couple days. Okay? And so where I'm going to put the tape is actually on the bone of the back, the spinous processes. And I'm going to give it about 50% tension because I just want to give feedback to the brain and nervous system. Now come back up. And then when we come back up, it should dimple a little bit. And it didn't. You know why? Because she's still not reversing that motion. Her back stayed flat when she bent forward. That's okay, it's her first visit. All right, so now hands on the hips and bend backwards. And that should feel even different to her. Is that even a word? Different to her?
Yeah.
Good, now do the sit test. Now, the tape's gonna stay on for about 2 to 3 days, unless you get irritated. If you get irritated, it gets itchy, just take the tape off. But it's a way for us to go home with you. So we're actually reprogramming the pain cycle using skin, because the skin and the brain, how much better? A lot better. Great job, you're amazing. The skin and the nervous system are once the same. So that's why acupuncture is so powerful, because in utero, when we're in your mama's womb, right, the skin and nervous system start at the same place. So if I put tape on the skin, or if I needle you, if I do soft tissue, if I do cupping, no matter what the modality is, the treatment is, if we understand that the skin and the brain are integrated, then it's easy to fix. Okay, hopefully you enjoyed this video. Please share it, please love us, please like us. I have a lot more video content coming up. We did almost 30 videos yesterday on Facebook, I'm sorry, on YouTube. And if you're not on the YouTube channel, go to our YouTube channel, like us, share the video, and please comment if you love. All right, Sempre Levante, always forward.